This week on the Neck Rec, it's been 2 weeks since your surgery. So what now? Well, welcome back everybody, and I'm your host Mike. And it's been 2 weeks, so what has happened since then? Well, first, before we get started, let me tell you that remember, I am speaking to you from a patient's perspective and not the doctor's perspective, and I'm basically sharing with you my experience. Some of you may have a different experience than I do, and my job here is to basically give you a framework on what to expect. So again, if things don't go exactly like I tell you to, don't worry, things will go fine. Now, in my last video, we talked about what to expect during surgery, and if you haven't seen that, I will link that in the description below, and I will also link my doctor's information, as some of you have asked who my doctor was, and that's Dr. Neil Shaw. Again, that information is in the description below. So what have you been doing in the last 2 weeks? Well, hopefully you've been taking it easy. Now, I know that you have been told that you needed to sleep upright in your chair and your couch. Maybe you still are on your liquid diet, hopefully, whether it be liquid foods, soft foods like jellos, things we talked about before. Probably, though, you may have cheated since then. Other things that you've been doing, hopefully, have been walking. And maybe in the last week, you've been walking 2 or 3 times a day. Again, this is to get the circulatory system working and to make sure that you're not dealing with any blood clots. So if you've been doing that and you scheduled your appointment, and again, it's very important that when you do have your surgery, that you scheduled your 2-week follow-up, because again, this is a very momentous time in your healing process. You're going to go see your doctor. Now, when you go in, first thing you want to do is absolutely communicate any problems you're continuing to have. Probably over the last week or two, if things have been going well, you've come off your pain medicine, but if your doctor's told you to stay on it a little bit longer, that's certainly fine. I found that after about 4 or 5 days, I was able to transition over prescription medications to over-the-counter medications, and that helped me quite a bit in my concerns of dealing with pain meds. But your doctor is also going to take a look at your neck, basically your scar, make sure you're healing well. Now, most of us who have had surgery, especially in recent times, especially this type of surgery, will be giving a liquid adhesive, and he's going to make sure that that's coming off well or has already come off to make sure everything's going well in that process. Another thing that he's going to do is order you to have an x-ray. He wants to make sure that your disc or disc that you've had installed in your neck are seated properly and things are going well. But again, like I've said before, communication is the key. Let him or her know that you're healing up fine, and if you are, well, the good news is there's going to be a lot of restrictions taken off of you at this time. Now, in my experience, I was given a soft collar to wear because I had 2 discs in the back of my neck, and my doctor's a little more conservative. But the good news is, at this visit, that collar was told to be taken away. I didn't have to wear it anymore. Another thing, too, that I was able to transition from the soft foods that I was eating into more of a regular diet. Now, let me really stress to you this. Your system has been used to soft foods over the last couple of weeks. The last thing that you want to do is go out there and get a greasy hamburger, because trust me when I tell you this, you will pay once you start putting in your system foods that it's not used to. So I really want to stress to you, kind of ease into it when it comes to changing up your diet. Now, another thing you'll may be allowed to do is to increase your activity level. Some of you that are very active may be allowed to do a lot more things than just walking around. You may be allowed to go back to the gym and be warned that you just need to lift a little lightly, and as you progress, you can go heavier and heavier. Another thing you might be able to do is drive, depending on your circumstance, so definitely follow your doctor's instructions with that. Now, for me, I wasn't released to drive, but I was allowed to be in a car. And again, he wanted to be conservative, so he told me as long as I was in the vehicle, make sure I had the soft collar on, just in case I was to get into an accident. Now, another thing you might be allowed to do is go back to work. Now, this is a very important time for you if you're having to do that, so let me tell you this. Remember, you have not been allowed to sleep horizontal up to this point. So the fact is, you probably are not getting the best sleep at night. So remember, if you're going to go back to work at a 2-week mark, remember your doctor is about to release you to lay flat and sleep in a bed, which, trust me, is a very welcome process. So if you're allowed to do that, I would advise you not to go back to work in 2 weeks, but give it about another week as you adjust back into a bed and get more sleep and get back to a more sleep pattern. That way, when you do go back to work, things will be in a more regular format and you won't be struggling with sleep and work and having to deal with all that mess. Plus, it might be rushing things along a little bit more if you were in that situation. Now, some of you may have had a very simple surgery when one disc was replaced and you didn't have many side effects to begin with, and your doctor has basically told you after surgery, hey, everything's great, you can do what you want. And in that case, just follow your doctor's instructions and things will be fine. So those are the things that you need to keep in mind as you take care of your business. Now, other things you need to worry about too is making sure your doctor tells you how much you can move your neck. Now, I will tell you something. These implants are very robust, and if they are seated properly and you're healing well, believe it or not, you'll be able to move your neck just fine, but your doctor may limit your motion to what we call a 30-degree plane. In other words, 30 degree this way, that way, up and down. You don't want to stress too much in your neck, especially if you're coming off wearing a collar. Again, common sense prevails in these types of situations. Again, if your doctor says it's okay to jog, be my guest. But in my case, I didn't think that was a very good idea because the bottom line is again, you don't want to be doing anything just jarring your neck or putting in additional stress on your neck. Remember, this is a marathon, not a sprint. So take your time in the healing process, but enjoy the fact that you have made it in your 2 weeks. Again, you're healing up great, things are fine, and things are going well. And I definitely congratulate you in making that decision. Just like we talked about in several of the videos in the past, it's a lot of stress to think about having surgery, and you did it. So great for you. Now, this video is not going to be a long video because things are going great and you've realized that your 2-week checkup is going to go perfectly. So in the next video, we're going to talk about several paths that you may take from this point forward. For example, you may continue on with your healing process with nothing to do, or in my case, I had to go through some physical therapy. So if you're going to go down that path, we'll talk about it in the next video. Now, if you like this video, consider giving it a thumbs up and subscribing to the channel. And I appreciate you watching, and we'll see you on the next one.